You are listening to the Horse Radio Network, part of the Equine Network family.
Welcome to this episode of the Disease Du Jour podcast on the topic of Equine Wobblers syndrome with Dr. Rachel Liepman. I'm your host, Kim Brown, editor of Equimanagement. The Disease Du Jour podcast is brought to you in 2023 by Merck Animal Health. Rachel Liepman, DVM, DACVIM, large animal, practices at Cave Creek Equine Sports Medicine and Surgery in Arizona. She attended veterinary school at Michigan State University, completed an equine internship with B.W. Furlong and Associates in New Jersey, and underwent advanced training to obtain her master's degree and certification with the American College of Veterinary Internal Medicine from The Ohio State University. Thank you, Dr. Liepman, for joining us today on Disease Du Jour to talk about Equine Wobblers syndrome, which is also known as cervical vertebral stenotic myelopathy, or CVSM. Last fall, you joined us on Disease Du Jour to talk about airway concerns in performance horses, and we're really happy to have you back to talk about Wobbler syndrome.
Thanks so much for having me. It's a pleasure to be here.
Well, let's just jump right in. So when you are dealing with Wobbler syndrome, what would be the initial complaints that would lead you to look for CVSM?
So there tends to be two different populations of horses that present for CVSM. The very young horse, so usually weanlings, yearlings, and rapidly growing horses. So they kind of fit in that 2 to 4 year old cohort. And then we have the older horse, often performance horses that start to have performance issues or have had chronic low-grade concerns that people haven't been able to get a hold of. And so generally, these horses are going to have ataxia, so, incoordination in their limbs, usually the hind end affected more than the front end. And depending on the degree, signs can be pretty variable. So it's sometimes ruling out other things and whittling down to looking at their neck for problems there.
And what sort of complaints would a rider or trainer bring to you that would say, hey, maybe I should look for this?
Yeah, so in the performance horse, we often hear about horses sort of having trouble taking connection, being stiff, turning on tight turns, not really wanting to collect or pick up canter leads, losing coordination in the hind end, especially at the canter, tripping, stumbling in the front end, or even in the hind end. Sometimes people will tell us about buckling, or just some trainers will tell us they just feel unsteady beneath me.
Huh. Okay. And when you're diagnosing these horses, kind of walk us through what your process would be.
So, first of all, of course, we do a thorough physical exam and get a good history. Oftentimes, physical exam is not very remarkable. Sometimes, depending on, what cohort you're looking at, you might see some muscle atrophy over affected areas. When doing more of an advanced exam, you might notice that their sensation over the skin and the deeper muscle planes over the neck or elsewhere are reduced. But usually physical exam, especially in the performance horse, without starting into the gait evaluation, is going to be fairly unremarkable. In a young horse, we often will see comorbidities such as, evidence of osteochondrosis lesions, so swelling in their joints. They might have flexural limb deformities. They usually are very large in stature, or history might tell us that they've had a recent growth spurt. Genetically, some of these horses, even if it's not genetically passed down from one sire to, the offspring, it can be just sort of like a genetic predisposition within a breed if they're bred to be really large and grow really rapidly. So they used to think that this was purely genetic, and now more studies are showing that this is more likely developmental. And so, if we have a line of horses or a history in the past, it's really important to ask those questions. Have you ever had these problems in this breeding line, or heard of problems in this breeding line before? Because sometimes we see patterns. We see it a lot in thoroughbreds. We see it also in large paint horses, appendix, warm bloods, of course. There's lots of breeds that have this problem. So keeping note of their breed as a part of the workup as well, and discipline of riding is important. So moving on to the gait evaluation, we want to look at them like a plain orthopedic lameness exam, but we also want to look at them for a neurologic exam. And so starting, just watching them walk, and if they're stable enough, trot. And then, of course, if they're stable enough, we can do a gait evaluation on soft ground in a round pen or in an arena to see what the complaint is that the owner or the trainer is reporting. And then we can watch their coordination. We can look at their proprioception, palpate their neck and back, look for a range of motion in their limbs, but also in their neck, laterally and dorsoventrally. Lift their head, take away the horizon, and make sure that their proprioception does not worsen. All of these things are part of a standard neurologic evaluation. And then, just assessing for weakness, spasticity, ataxia, all those things that we might see in a horse with CVSM, depending on the severity.
Today's Disease Du Jour podcast is brought to you by Banamine, flunixin meglumine injection from Merck Animal Health. The pioneer NSAID for horses in the U.S., Banamine goes to work quickly to alleviate pain and inflammation from musculoskeletal disorders and visceral pain from colic to horses in your care. Don't get caught on call without Banamine. Find out more at mercanimalhealthusa.com. Do not use Banamine in horses intended for human consumption. The effect of Banamine paste on pregnancy has not been determined. See product label for complete safety information. When you go to diagnose, are you using radiographs, ultrasound? What other more are you using to work on these horses? Work up. That's the word I'm looking for.
Yeah, so first things first, we do that gait and neurologic evaluation, and we have to ask a couple of questions. Do they have a neurologic problem? And then that's a yes or no. Yes, they have a neurologic problem. Next question, where do you neurolocalize the problem? If you neurolocalize the problem to the neck, then we move on to next steps. If you neurolocalize the problem to the back, of course, we're going to take a different course. Our imaging is a little bit more limited for those vertebral bodies in that region. If you neurolocalize elsewhere, to the brain, of course, that's also going to require different testing. So one of the things that we often do to kind of work these up is make sure that systemically they're well. Get their vaccination history, make sure that they've been properly vaccinated for the core diseases that can cause neurologic problems like the encephalitides, West Nile virus, which we've seen more and more in recent years, herpes, which we know is not protectable via a vaccine alone. So all of those things kind of potentially think about doing some testing in that vein to test for viral things that could cause neurologic disease, potentially do some blood work if we feel it's necessary to check their systemic wellness, and then consider neck x-rays to start, usually where most people are going to go if they neurolocalize, of course, to the neck. So we'll often start with plain lateral x-rays, so just straight across, really straight x-rays to the best of your ability. Sometimes that's hard to do in a wobbly horse or in a sedated horse, or in the field. So doing your best to get really good straight x-rays of all the vertebrae in the neck all the way to C7, T1 if you can. Caudal neck is the most commonly affected area in the horse that's been doing performance that's, more advanced in age. So, teenager to older. And that's going to be the hardest place to image for most practitioners, but a really important place to see if possible. If you're skilled enough, doing oblique radiographs of those regions can also help. You can see more of the articular facets, because in these adult horses, we often see spinal cord problems, either compression, angulation, or nerve root compression due to arthritis and soft tissue remodeling of those facets. Of course, you can also have problems of the body's alignment. You can have malalignment. You can have actual malformations of vertebral bodies that can cause compression. And you also have to look at the disc spaces to see if there's any disc disease that could be underlying the problem. So x-rays are going to be first line for most. Those that have access to more advanced diagnostics, many are now using CT, which will give us a lot of information with or without contrast. And of course, probably one of the most widely used things is a myelogram. So a contrast study to actually see in neutral, flexed, and extended spine if there is compression of that spinal column. The DI column goes into the intrathecal space and highlights that subarachnoid CSF cavern so that you can see if that is narrowed at all. So all of those things, those diagnostics are really helpful. There's other researched diagnostic tests that aren't widely used yet. MRI isn't quite as useful as CT. CT myelograms are super useful, and we're getting more and more information about those as some of the big practices are seeing so many cases, in the big racehorse country, and able to use those diagnostics to learn more.
And when you're looking at treating these horses, how do you like to proceed with the various cases you see?
Really depends on the severity. Sometimes we see them because they have some neck pain or perceived neck pain from the rider, and they really don't have overt neurologic signs at that time. And so those ones were probably likely to get some relief from cervical facet injections with either steroids or regenerative therapies. So depending on the case and the different things involved, we can make those decisions. And we often will get some good relief from those treatments in the performance horse to allow ongoing training. And then we always recommend rehab practices to try to strengthen the neck after we do injection. So it's not just poke and go. We really encourage clients to, now that they feel better, really condition them properly, do stretches, and try to keep their mobility up, because we know that they have a problem. Of course, if they start to have neurologic disease associated with this, then it becomes more problematic. Sometimes neck injections can help, but oftentimes it's not going to resolve the problem to make them safe riding horse, depending on the grade of neurologic disease that they present with. And so sometimes we give them systemic therapy if they come in an acute crisis, IV steroids, plus or minus NSAIDs, DMSO, often just anti-inflammatory medications and supportive care. And sometimes that can get them out of crisis, but they're often not going to return to a rideable state when they come to us like that. Otherwise, maintenance things like keeping them on joint support can be helpful. Legend and Adequan are widely used. Other, feed through like Cosequin products are useful. There's so many options out there, but joint health can be helpful for these horses because part of the issue is joint mobility. And then, really oftentimes if they present to us in pretty bad shape, their prognosis isn't great. And so they're either retired or, depending on how bad they are, if they're a danger to themselves or others, they may be a candidate for humane euthanasia.
I've seen some really bad ones in my life because I was raised in thoroughbred country. So those fast growing thoroughbreds can get a little scary when you're trying to work around them.
In adult horses, depending, and I guess some of the valuable racehorses, if they catch it soon enough, they can do surgical revision with a ventral fusion of their spinal column. And, some of them, depending on how much damage to the spinal cord they have, can do quite well. I don't see the population of thoroughbreds that is seen in Kentucky where, they do a lot of these surgeries, but anecdotally, I think they say like over 80% of those young racing horses that are fit and have some of these instability / malformation, if they can get it soon enough and operate on them, they can have good outcomes. So, greater than 80% good outcomes, anecdotally, of course, but still from some pretty experienced people that are seeing these horses all the time is a pretty good outcome. So if it's in the cards, sometimes the young horses, as long as they don't have a really severe malformation, can do quite well with the ventral fusion. And of course, the older horses, it's sometimes an option, but they often have other issues that complicate it a little bit. So it may not be as good of an option for those horses.
Yeah. So what kind of follow-up? You mentioned you always encourage after, for example, injections, some rehab. So what other follow-up will you do on this type of a horse?
Of course, it depends on the owner if they'll agree to come back. But I always recommend, just evaluating them, especially if they have neurologic signs. I would say about a month after treatment, and just kind of reassessing how they're doing. We'll often stay in touch with the owners as they're starting to ride again with these mild horses that have neck pain. And, they're usually quite pleased. So we hear good results. And sometimes, the horse doesn't respond, and that means that, they're probably going to have a worse prognosis overall for return to work. But really, we don't have to do a ton of follow-up. It's just, it is more up to the horse owner, rider, trainer, how the horse is doing. I don't think we can easily prescribe a duration of these treatments lasting. It just kind of depends on the horse's needs, and usually kind of figure it out because they show you subtle signs that you recognize in the future after they've been diagnosed once. So we can kind of try to maintain them to the best of our ability going forward based on those things. But I really feel strongly that rehab with stretching and strengthening is a huge part of success in these horses going forward.
That's a good point. And is there anything else, Dr. Liepman, that you'd like to add from your experience of seeing these types of horses, especially the adult sport horses?
Yeah, I think it's just important to listen to your gut on these because it can be dangerous to ride these horses. And as your veterinarian, we have to look after the health of the horse and also the safety of the people around the horse. And so if you have questions, it's worth an evaluation. And, there are other things that it could be as well. And, in order to do a proper workup, there's more testing that can be done. It might not be the neck. It might be that they have EPM or West Nile virus or EDM. There's lots of different things that it could be that we need to do additional testing, for example, spinal fluid testing on those horses to rule that out before we blame it on the neck. And sometimes it is the neck, sometimes it's not. And so another thing I'll mention is just in these young horses that have a propensity for OCDs, if you've got one of those, it's not uncommon for them to have OCDs in their articular facets as well. And so that could predispose them to arthritis in the future. And so, getting those things checked out early and doing what you can to maintain. If you have a breeding stock that you're noticing a lot of these youngsters are having issues, it could be that they need a review of their nutritional program. And there's, how much they're being fed and how much they're being stalled, how much they're out. All of those things are important for your veterinarian and sometimes nutritionists to help with, to make, a difference going forward. So it's a tough disease, but we've come a long way, and we have had a lot of good successes with these horses long term.
Well, I really appreciate you, and thank you, Dr. Liepman, for joining me on this episode of Disease Du Jour. And a big thanks to our audience for listening to our podcast, and a special thanks to our 2023 sponsor, Merck Animal Health. And if you have any questions or suggestions, you can send an email to me at kbrown, that's the letter K Brown, at equinenetwork.com.